This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222.
One last question, Prof, and I think we'll probably have to wind up. We're pretty close to finishing. Your opinion on alcohol's effects on fertility treatment, where a lot of people say caffeine's safe, but alcohol's not.
Okay, there are wide views on this. Now, we all agree on one thing: heavy drinking is bad for you, both for the male and the female. There's no question. What do I call heavy drinking? I say it's more than what I drink. That's not very helpful because I'm probably not a moderate drinker. But certainly heavy drinking and binge drinking is bad, not only for fertility, but also for the pregnancy afterwards. The Australian government and HMRC guidelines say no alcohol. And they're basing that on what can happen in pregnancy with heavy alcohol intake. So unless you ban it or you make people not do it at all, you hopefully will avoid the heavy drinking issues, something called fetal alcohol syndrome with mental retardation. I personally have a view that anything in moderation is fine. And for alcohol, having a glass of wine once or twice a week does no harm. I can't see any evidence that it does any harm that much. The problem is when I ask patients how much they drink, they say 1 or 2 glasses a week. If they're telling me that, they're probably drinking more. But so we encourage them to, absolute minimum. Social is fine. In relation to caffeine, again, it's about the pregnancy as much as the fertility. 300 milligrams, which is, I think it's two strong coffees a day, is probably just on the borders of being acceptable. But yeah, I think in moderation. I don't say ban anything as long as it's in moderation.
Well, Prof, thank you very much. How do people find out about you?
Right, okay, so it's Professor Michael Chapman. I am at IVF Australia at Cogra. The 1-800 number will post for you, or if you want to go direct to the clinic, talk to my receptionist, 9598. No, I've forgotten it. 958 5505. Yes, that was right. 9598 5505.
Yep, I'll post those in the chat here as well, Prof. And they can find out more about you at theivfjourney.com.
Yeah, so anybody that wants more information, I was showing someone the podcast today, and they went, what, 280 episodes? Wow. And so we cover most things, little chats like this.
And don't forget that you can access all the previous episodes by going to our website, www.theivfjourney.com, and select IVF Journey Podcast from the navigation menu.